We want to find that balance of protecting people as best we can and protecting.
When Dr. Bonnie Henry sat down with me 6 months ago, the WHO had just declared the global pandemic.
COVID-19 can be characterized as a pandemic.
Washington State, south of BC, was ground zero for North American cases. Since then, Dr. Henry's calm guidance, drawing on her years of being on the front lines of public health crises, including SARS and Ebola, have made her briefings a weekday ritual for many British Columbians.
As we continue to move forward in our COVID-19 response, it's important that we don't leave anyone behind.
And turned her into perhaps an unlikely celebrity. But in the last few weeks, the number of cases of COVID have been rising.
These numbers are concerning to us.
British Columbians are getting anxious, and the province's back-to-school plans have angered some teachers and families. I sat down with Dr. Henry at the BC Legislature Library this week and began by asking her to compare where we're at right now to 6 months ago.
At that point, we did not know what we were looking at. We had seen what happened in China, we'd seen what happened in Italy, in New York City was exploding. So that was a potential for us. Where we are now is somewhere completely different in that we know a lot more about this virus now. We know how it's transmitted. We also know the impacts of the measures that we had put in place in March and how they affected people in our community across the board. So we need to find a different balance now going into the fall.
I know people just in my personal life who, when they hear the case counts now, they seem to take it personally, like a punch in the gut, especially when the numbers are above 100. How do you feel when you announce those numbers?
Well, they make me anxious as well. We did such a good job in BC, working together. People really took this to heart, and we all did what we needed to do to get that curve back down. Right now, what we're seeing is a lot more testing. So we have the capacity to do that. And we're also seeing illness and cases, not a lot of illness, but cases in younger people. So we know that it's still circulating. We know that. We knew that was going to happen. We also know that we know how to control this. We do it through case management, we do it through contact tracing, trying to keep a lid on it, trying to keep it away from those we know now are more vulnerable, particularly our elders and seniors. And so when I get anxious, I look at our hospitalizations, I look at our ICU, I look at what's happening. Can we link cases? And we're doing a good job of that. But it is at that point where we need to refocus. We need to refocus because it is also really important for the wellness of our community to get people going back to work, to have children going back to school. And to do that, and to continue to do that safely, we need to make some sacrifices in other parts of our life.
Are we less safe on a day-to-day basis today than we were, say, 6 weeks ago when the numbers were much lower?
Not at all. I think we are recognizing where this virus is circulating and we're able to keep it controlled. We still have very low rates of transmission in our community, and that's something that is a testament to how we have worked at controlling this in BC. So as long as we keep those rates low, everything else that we need to do for the wellness and health of our community, we can do that too.
But let me ask you to clarify that, because I saw some people just this week on Twitter saying, how can she say we have low rates of community transmission when we see case numbers exceeding 100 on many days?
Yeah, but if we look at 100 compared to the population that we have, and we know where those people are picking this up, so we can trace them back and we can stop that. And it's how many that each individual case is transmitting to that's important as well. So those are still very much under control here.
I have to say, in my many years as a journalist, I've never seen a public official who's received so much support and adulation at times than you have in British Columbia and across the country. But on a couple of issues, and one of them is schools, I've seen people, teachers and some parents who say, Dr. Henry doesn't have my interests at heart. She's not properly protecting my kids. How do you respond to that?
Yeah, that's hard for me to hear because absolutely the most important thing that we want to do is to be able to have children back in a learning environment and to do it safely for everybody. And that has been our overriding focus. And we do know that there have been downside impacts of children being at home. Even in families who have access to internet and computers, it has been very, very challenging. And we've heard that from parents across the board. 80% of parents, the 300,000 people who answered our survey, 80% of them said they had challenges and their children were suffering not being in the classroom setting. So that was our focus. And we have layers of protection to do that. It is always anxiety provoking, and at this time of year, going back to school has always been a challenge. Everybody, kids are anxious, parents are anxious, teachers are anxious, and it just is compounded by this pandemic. But we can manage it, and we can do it, and we've been learning from other places around the world that have done it successfully, and we'll do it successfully here too.
So schools have become a contentious point in British Columbia. The other contentious point, and this has been almost from the beginning, is masks. And I see so much feedback generally, but specifically directed to you, saying, why is Dr. Bonnie Henry ignoring the scientific evidence on masks?
That does make me smile, because I've been the supporter of wearing masks at the right time in the right place and the right mask for a long time. And early on, of course, our focus was ensuring that we had medical masks in our healthcare system. And as you will recall, there was a shortage globally of those masks. And there was concern as well, and we didn't know much about wearing masks in the community and what types of masks would work. And I have always said that yes, if people want to wear them, that we should support that we should not be stigmatizing children and others for wearing masks, and that it is an important sign of respect in many cultures, and we know that. As we've progressed, we have learned that there is a place for masks. It's not the first line of defense. It is part of what we can do, particularly for those situations where we can't maintain our safe distances, where we may be encountering people we don't know. So there's many different situations where masks can be of benefit, and we've watched that evidence. We've also seen that the culture, the understanding of how to wear a mask and the availability of masks has increased. So this whole idea now of having non-medical masks and people using them is absolutely something that I support.
We're not wearing masks now. Would we be safer right now if we had masks on?
No, you see, these are the things that we have learned. There are times when you need it. If we were sitting closer together and we were having this conversation, then absolutely. But if you can maintain your distance and that's safe, we know that. With a large environment, lots of empty space, this is good. Outside is safer than inside. If you're walking by somebody on the street, that's not a situation where you're going to pass this virus on. It is much more those indoor settings. Transit is a perfect example where you can't maintain the distance, and it can be helpful to have a mask on, particularly if you are sick or if you've been exposed to somebody with the virus. Then those are important things where you want to stay away from others.
It was early in the pandemic when this moment caught the attention of the country. Moments like that in her daily briefings drew a lot of attention and praise for Dr. Bonnie Henry for her compassion and humanity in the midst of the pandemic. I asked her about that.
I do feel those things quite intensely. I look back at that time, and it really was this feeling of we're in for a long haul here, and it's going to be hard. And having been in the SARS outbreak in 2003 and knowing just the emotional and psychological impact of that feeling of fear and anxiety and vulnerability that you get when this strange virus comes in and disrupts your world. I don't think I knew at the time how long it was going to be, but those are things that do strike me. On the other hand, I'm also struck by the sense of resiliency that we have. I get letters from young people and kids, and I've been talking with kids in the last little while around their anxieties about going back to school and what you can do. And I am so struck by how resilient children can be. And we just need to give them what they need, which is, this is going to be okay. We'll get through this together. We'll work it out. And if we don't know the answers, we'll find them together. The other people that I'm struck with are elders and seniors, and how much I have learned from them.
Let's look ahead with my last couple of questions. First one is vaccine. What's your best guess as to when there'll be a vaccine available?
Oh, the optimist in me is like early 2020 or 2021. I see a couple of good things. A little bit of a setback with one of the vaccines recently, but
are you getting updates?
Oh yes, absolutely. We follow. There's about 50 some that we're been following, but yes, the vaccine is something that's going to be incredibly important. I also think coming into influenza season, protecting everybody from influenza is going to be paramount. One, because we don't want people to be sick and have symptoms that might be confused with COVID, but also to keep people from having to be hospitalized. And we know influenza does that every year. It's particularly for the very young and our elders. So, those are important. A COVID vaccine, I'm hopeful in the new year, and by next summer, we'll be in a good place.
So you preface that by saying the optimist in you, which I applaud, but I'd like the realist in you to give me a view as well. Is that still kind of that timing next summer?
Yeah, I think by next summer, if the vaccines that have been, there's about 8 right now that are in phase 2, 3 trials, and I expect at least one of them will work out. Whether it's going to be available around the world and how long it's going to take is going to be a little bit more, but we're planning for that. And it'll be, I expect, will be in stages. So there may be different vaccines for different populations. But if we can protect those who are most at risk, if we can protect our elders, people with underlying illness, and our healthcare workers, then we can really get back to a much more normal, if we will.
I guess as a final word, what will you say to people watching, not just in this province, but across the country, about what we're facing here with COVID-19?
Yeah, you know what? I think we need to continue to be positive, continue to take that deep breath and be kind to each other. But I also think we need to remember that we are resilient. We've got this far. We know so much more than we did even 6 months ago. And we need to be patient. We need to be patient and be ready, and we will get through this.
All right, Dr. Henry, it's always a pleasure talking to you. Thanks.
Thank you.